Good morning, Professor Amfo.
Good morning.
So this morning we want to talk about public service interpreting, especially in our contexts in Africa where we have several languages, etc. But I want to ask you, what do you think is the relevance of public service interpreting in Africa and elsewhere when we compare it to other forms of interpreting, and what are the contexts in which we would need public service interpreting?
Thank you. I think that public services interpreting in Africa is extremely crucial. We are talking about a continent that has more than 2,000 languages. So multilingualism is rife in every country in Africa. And so public services interpreting is very, very important. However, in the past, we haven't paid as much attention to that. When we talk about multilingual language use interpreting, we are very often thinking about conferences. We are also thinking about education, language use in education, and even in our religious context, like in our churches and so on. But when it comes to provision of public services, like healthcare, like services in our judiciary systems, like going to our ministries and agencies to access various services, we haven't given that the attention that it deserves. So it really deprives people of the quality of service that they can get from these agencies and ministries.
And do you think that we need to have people who are trained to do this? Because, people have been doing it without training for years. You look at the churches, you have a lot of lay interpreters, can put it that way. Do you think it's necessary to have any form of academic training to be a public service interpreter?
Absolutely. We need training. I have been to the courts once or twice, and I have heard people interpret, and I have wondered whether people haven't gone into jail because of the quality of the interpreting that they have received. So yes, we need to train people so that people do not just rely on their guts feeling to interpret, but people are well versed in the specialized vocabulary that are required in this context, the various registers, and also the cultural context within which all of these interpreting need to be done.
So if we have such a training for public service interpreters, what do you think should be the content of a well-designed course?
Well, a well-designed course would have to, first of all, ascertain the proficiency levels of the trainees in the various languages in question. And then we would have to look at the technical aspects. So we look at issues of register and vocabulary, because you cannot train in the same way the person you are training for the healthcare setting, for the judiciary setting, or the course setting. So those technical aspects will have to come in, and then we would have to take into consideration cultural norms and expectations, so that these people are able to function well in the cultural context within which they are going to be placed.
Thank you. And in this case, do you think that we need to get locally trained interpreters, for want of a better word, homegrown interpreters, instead of resorting to foreign interpreters for this kind of service provision?
Yes, that would be very, very important. I remember, some survey that we did in 2015 together with the late Professor Maninye and colleagues, that was on effective communication in public healthcare delivery in sub-Saharan Africa. So we did surveys here in Ghana and also in Nigeria. And it came out very clearly that people, majority of people are most comfortable when seeking healthcare services. They are most comfortable with people who would speak the same language as they do and who will understand, their various indigenous languages. So I think that people just are comfortable with people that they can identify with as being a part of them as their own. So within this context, it is therefore important that we train homegrown interpreters. And also these people have the tendency of going to be with us for a very long time. And so when we invest in the training of, local people, we can be sure that we would reap the dividends of the training programs.
And in training such interpreters, do you think gender needs to be taken into consideration? For example, having more or having quite a number of female interpreters, and why would this be necessary, for example, in the court or in the hospital or at the police station to have a female interpreter?
Yes, I mentioned earlier on that people feel comfortable with people that they can identify as their own, and this includes language, it includes gender. In the healthcare setting, for example, there are certain sensitive issues that the female will feel most comfortable discussing it with a female healthcare personnel, and the same thing is with, when you're in the police station or in the court system, you're usually dealing with issues that are quite sensitive. And I think that making the conscious effort to train female interpreters will be giving our female population generally access to quality public services.
Thank you so much. And we already have the PAMCIT program running, for example, at the University of Ghana, where we train conference interpreters. But do you think that if we include public service interpreting and translation into the program, it will be of any use? What's the relevance, if I may ask?
I think that yes, PAMCIT, we've had the PAMCIT program running for some time now, which is extremely good, and it has trained a lot of people for conference interpreting. But within the community, how many people know about PAMCIT, or how many people have felt the benefit of the PAMCIT program? I think that if we move into public services interpreting, then that allows the opportunity for PAMCIT to be felt within the local communities, because we are training people who will then go and serve in these local communities.
And thank you very much.